24 away from 9. Now, what is the impact of all the coronavirus disruption on people with disability and clients of the National Disability Insurance Scheme? From evidence given to the Royal Commission into violence, abuse, neglect and exploitation of people with disability, there have been harrowing tales of people left without carers and disconnected from services. If you want to know if the situation has improved since the early days of the pandemic, the figures suggest that NDIS clients are only using 2/3, 68% of their plan funds and hence not getting the support they're entitled to. The data comes from advocacy group Australian Communities, and Dorothy Kamaker is a senior consultant with Disability Health Support, joining us now to go a little bit deeper on this story. Dorothy, good morning.
Good morning, Simon, and good morning, South Easters.
Thank you so much for joining us on ABC South East. So why has the pandemic made it harder for people with disability to connect with those essential support services?
Well, to put this in a larger context, it's been difficult for everybody. I specialise in supporting people in the NDIS with health issues that are preventing them from reaching their goals. And the whole community has suffered in that perspective. So everybody has found getting healthcare difficult. But the NDIS, for NDIS participants, this is not a level playing field. The health system has been set up for the general community, has been set up not particularly well for the aged care and for mental health. And most hospitals will have departments that will have specialists and will focus on those minority groups. But no hospital I know of looks after NDIS clients and says, look, this person has chronic illness, they have difficulties accessing the services, their support may be less effective or less present than for other groups. And that group has fallen behind markedly in accessing their health care. And in your promo or in your introduction, you said that some people are only using 68% of the funds that were allocated. And we're finding that is particularly true for the NDIS community with healthcare. And so allied health services, physio, occupational therapy, they're not able to access, and they were closed down, those services, or the NDIS clients were not prioritised for access to those services. Now, next time when they go to re-establish their funding, to reassess their plan, 68% got spent. Therefore, you probably only need 68% of what you had. They will have to fight to get that funding back next time.
I see. So the implications are pretty serious once you kind of fall back on spending in your plan.
Oh, yes. You find that you establish the norm, and nobody's going to say, well, the system penalised you. This was a system issue. You will be asked eventually to say, well, if you only spend 68%, maybe you don't need 100%. But, the issues with NDIS clients is that they are, if you like, unsexy in the health system. They're not quick hits. They often have multiple diagnoses. They have chronic disease for life, and their health problems get between them and achieving their goals, which make them independent and build their capacity so that their need is greater, but the system is least user-friendly for NDIS clients. And at Disability Health Support, well, my larger company was Patient Advocates Australia, where I do this for all users of the health system, where I sort out their problems with healthcare regardless of their background. But for NDIS clients, the Disability Health Support is going in there and backing both with the health system to get the best outcomes for them. We're at their side. And then we support them when their NDIS plan is being reassessed to make sure they're not going to lose their funding.
Is this a big step backward from where we were before the pandemic? Was there a good success rate of people utilising what they were entitled to under the NDIS before the pandemic hit?
No, it's not. It is just the specifics of this are really going to be where you have to re-establish the funding. NDIS clients have always had a difficulty with the health system. The aged care patients have always, the outcomes, the measured outcomes and all the evidence says that the health system has its best outcomes for the least ill and the best able to fend for themselves in the system. And then the NDIS clients have always lagged behind that because it is not a system that copes well with NDIS participants who have chronic illnesses and multiple diagnoses. So, I mean, the idea that there is no NDIS specialist, somebody who says, we will look after you, we will deal with your NDIS-specific goals within the general health system, I think says it all. You know, it's very hard for an NDIS participant to get to the top of a waiting list even. I find that there's quite a bit of discrimination when I ring up and say, I'm booking this client in, she's an NDIS client. I can feel the climate at the end of the phone changing.
How much harder is it for people in areas like the South East, rural and remote areas?
Oh, very, very difficult because in a larger centre you can choose if your provider has closed down during COVID. You've got a much greater choice. But in the regions, it's been terribly difficult because there's often one or two providers only. I've got clients I've got a lot of regional clients, and in regional Victoria and regional New South Wales, I've gone into bat for them only to find that I had no options. I had no other options for them. So the only good thing that's come out of it, I think, and this will stay, is that telehealth has meant that NDIS clients do not have to get in a vehicle and physically go to a place in the way that they used to have medical consultations. But physiotherapy can't be done for an NDIS client via telehealth. It has been done for my general clients. They can often do it on Zoom, but not NDIS clients as easily because they need a lot of support when they're doing OT, physio, speech therapy. They often have to go to pools, to swimming pools to do their exercises. So
Dorothy, what's your advice to someone who's a client of the NDIS or advocating for someone who's a client of the NDIS and struggling to get the services to actually make sure they spend and get what they're entitled to under their plan?
I obviously, because I'm an advocate in this area, I know that the outcomes are way different if you have an expert advocate at your side who can walk you through it. So don't wait until you've got a big problem. It is so much harder to undo a problem than it is to prevent a problem. And, that applies to my general patients in the health system. If you're sitting in hospital thinking, gosh, this doesn't seem right, and you wait, by the time you contact an advocate, you find that getting the poor care undone or the poor communication undone is really difficult. So my advice to anybody who's in the NDIS or in the general health system is go early and go prepared with somebody who can walk you through this, get different outcomes through walking you through a system that they are familiar with.
Well, great to talk to you about it, Dorothy. It sounds like it's an issue that'll affect a lot of people. And thanks very much for your time on ABC South East this morning.
Have a great day.
You too. Dorothy Kamaka there, the senior consultant with disability health support, talking about the number of people left behind in the pandemic on the NDIS. She's telling us that the pandemic has left more than 100,000 Australians with a disability disconnected from essential support services and not getting all of the support that they're entitled to under the NDIS. It's 8:45 here on ABC South East. Now we will talk about those New South Wales